Hello, I'm Steve Fihn, and I've been invited to provide a bit of advice about how to create an effective poster for the national meeting. You're probably watching this video because you were fortunate enough to have your abstract accepted. Now, maybe you're bemoaning the fact that you were not selected for an oral presentation, but let's be honest, attendance at some of the oral sessions is sometimes scant, and as a poster presenter, you'll have the opportunity to have close interactions with individuals who likely will become colleagues or collaborators in the future. You should understand that there is a remarkable number of very bright and talented individuals in SGIM, such as yourself. At the 2016 meeting, for example, there were nearly 1,400 presenters who described their work in 7 sessions. There's a vast amount of information being presented at this meeting, and the human brain can only absorb a tiny fraction. And for some of us, an even tinier fraction. So if after a long day of lectures, workshops, and oral abstract presentations, you were foolhardy enough to want to try and view every single poster in a session, you would have precisely 20 seconds per poster, not including the time to navigate the crowds, chat with long-lost colleagues, and fetch that all-important adult beverage. In terms of designing your poster, the maximum dimensions are 42 inches high and 84 inches wide, but in no way feel obligated to fill the entire area. White space is good. It attracts the eye. Now, the Lords of SGIM have distributed some guidelines for creating a poster that are, for the most part, reasonably sensible. They suggest use a clean, simple font throughout the poster, at least 18 point, larger if possible. Definitely do not overuse capitalization, italics, underline, bold, and so forth. Use color sensibly. Avoid red and green. 7 to 10% of we men have red-green color blindness. And most importantly, do not overcrowd. Remember, white space is good. Use graphs or charts rather than tables when possible. And I think it helps to title a graph with a conclusion. Now, this poster presents some fairly complicated data in an easily digestible format. You can tell quickly from the title that it's about predicting risk of hospitalization or death. You can quickly see it's a very large number of patients, almost 5 million. And from the conclusions, you can see that the models are quite accurate. That's discernible from these calibration curves, which are very visible. And at that point, you can decide, maybe I want to look at the stratification, I may want to look at the variables, or I can go on to the next poster. Now, as we said, it's good to have graphics, including photos, graphs. A table's okay. As you can see in this case, it's comparing urban and rural clinics. It's easy to discern from the pictures that we're dealing with urban and rural. And in these figures, very easy to see that rural clinics seem to do better than the urban clinics in a variety of ways. And then we can go down and look at the specifics. So once again, you have the option of getting more detail or going on to the next poster. And finally, please don't be discouraged if I take only a quick gander at your poster, because I will be trying to see all the posters in the session while balancing a plate of food and my adult beverage. See you at the national meeting.